किसी व्यक्ति के निर्माण का स्वर्णिम समय यौवन काल होता है, जिसमें वह आने वाले लंबे जीवन के लिए शरीर, मन और आत्मा का निर्माण और विकास करता है। इसी नींव पर अपने जीवन का मजबूत भवन खड़ा करता है और उसका भोग करता है। किसी भी राष्ट्र के विकास की आधारशिला और ऊर्जा उसकी युवा शक्ति ही होती है। यही उसका आत्मबल और इच्छा शक्ति भी होती है। इसीलिए कहा गया है, वीर भोग्य वसुंधरा। राष्ट्र निर्माण के ताने बाने में यौवन के ही धागे होते हैं। अतः जो राष्ट्र अपनी इस ऊर्जा का संरक्षण और संवर्धन करता है, वह विकास के उच्च शिखर पर पहुंचता है। राष्ट्र के कृषि, उद्योग, शिक्षा, चिकित्सा, तकनीक, राजनीति रूपी चक्के को यही युवा शक्ति, ऊर्जा व गति प्रदान करती है। यह राष्ट्र की रगों में बहने वाला गर्म खून है, जो उसे चैतन्य और प्रगतिशील बनाता है। भौतिक व आध्यात्मिक दोनों के विकास में इसी ऊष्मा का तप सक्रिय रहता है। इतिहास साक्षी रहा है कि जब किसी राष्ट्र की धुरी लड़खड़ाई है, युवा शक्ति ने आगे आकर अपने पुरुषार्थ से उसे सुदृढ़ बनाया है। आज अनेक प्रकार की समस्याएं जैसे नशा, फैशन परस्ती, पाश्चात्य जीवन शैली, आस्था संकट, भ्रष्टाचार, बेरोजगारी देश की युवा शक्ति पर आरूढ़ हैं। आज युवा शक्ति को आत्मबोध एवं अपने सांस्कृतिक गौरव से परिचित कराना समय की मांग है। वर्ष 2011 की जनगणना के अनुसार हमारे देश में 35 वर्ष तक की उम्र की 65% आबादी है। यह युवा शक्ति जिधर चल पड़ेगी, देश भी उधर ही चल पड़ेगा। अतः देश का भविष्य अब युवाओं के हाथ में है। यह युवा शक्ति ही राष्ट्र शक्ति बनकर राष्ट्र को समृद्धि, उन्नति एवं प्रगति के मार्ग पर ले जाएगी। युग ऋषि पंडित श्रीराम शर्मा आचार्य जी ने युवा की अद्भुत परिभाषा दी है। युवा वो है असंभव जिसके शब्दकोश में नहीं, जो बाधाओं को चीर कर अपना मार्ग बनाता है, जो परिस्थितियों का दास नहीं, उनका निर्माता, नियंत्रणकर्ता एवं स्वामी है, जो भाग्य नहीं, अपने कर्म पर विश्वास रखता है, जो उमंग, उत्साह, जोश से जीता व सुनहरे भविष्य के सपने देखता है, जो स्वयं सब कुछ करके गौरव अनुभव करता है और विश्व में कुछ अनूठा करना चाहता है।
असमंजस व अवसाद की स्थिति से गुजर रही युवा पीढ़ी को दिशा देने का काम एक चिंतक ही कर सकता है।
नमस्कार।
वर्ष 2006 में देव संस्कृति विश्वविद्यालय के दीक्षांत समारोह में पूर्व राष्ट्रपति डॉक्टर एपीजे अब्दुल कलाम व श्रद्धेय डॉक्टर प्रणव पंड्या जी, जो विश्वविद्यालय के कुलपति भी हैं, मिले और इन दोनों चिंतकों ने मंथन किया कि युवा पीढ़ी को एक सृजनात्मक मंच देने की आवश्यकता है जो राष्ट्र निर्माण में सहायक हो। यहीं से दिया की नींव रखी गई।
I am indeed delighted to participate in the second convocation of Dev Sanskriti Vishwavidyalaya. I am very happy that this institution has been created with a motto of developing the divine culture, which is important to us while we are on the path of transforming India into a prosperous, happy and peaceful society. We have the responsibility of transforming India into a developed nation before the year 2020. It is an endless journey through knowledge and enlightenment. Such a journey opens up new vistas of development or humanism, where there is no scope nor room for pettiness, disharmony, jealousy and hatred or enmity. It transforms a human being into a wholesome whole, a noble soul and an asset to the universe. God.
जिस तरह एक दिया अंधकार को दूर करने की क्षमता रखता है, दिया भी इस देश के युवा मन से अंधेरे को दूर करने का स्वप्न लेकर चला है। ये प्रशिक्षण और कार्यशालाओं के माध्यम से शिक्षित, स्वस्थ, आत्मनिर्भर, विनम्र, संवेदनशील दिव्य युवाओं को तैयार करने के लिए प्रयासरत है, जिससे राष्ट्र निर्माण की गतिविधियां चलाई जा सकें, दिव्य भारत पुनर्निर्माण हो। इसका लक्ष्य युवाओं की क्षमताओं का विकास कर दिव्य भारत का निर्माण करना है, जिसमें व्यक्ति, परिवार व समाज का उत्थान हो। दिया युवाओं के सपनों में आदर्शवाद लाकर उनकी वैचारिक प्रक्रिया में सकारात्मक बदलाव लाने के लिए प्रयासरत है। वैज्ञानिक अध्यात्म के माध्यम से युवाओं में देवत्व की अभिव्यक्ति, दुनिया में सद्भाव के साथ सतयुग की वापसी इसका परम उद्देश्य है। इस तथ्य की महत्वता समझते हुए वो डॉक्टर कलाम के भारतवर्ष को वर्ष 2020 तक एक समृद्ध राष्ट्र बनाने के स्वप्न की ओर युवा शक्ति को अग्रसर करने के लिए दिया इस महान राष्ट्र के युवाओं के लिए एक आंदोलन है जो मजबूत सिद्धांतों और यथार्थवादी लक्ष्यों पर आधारित है। जो लोग दिल और दिमाग से युवा हैं एवं जो एक नए भारत की परिकल्पना के हमारे स्वप्न से सहमत हैं, उम्र, जाति या धर्म की परवाह किए बगैर हमसे जुड़ें।
मुझे विश्वास है गायत्री परिवार के दिया आंदोलन के माध्यम से देश के युवाओं में वो संवेदनाएं प्रकट होगी, सामाजिक जिम्मेवारियां प्रकट होगी, एक साहस की वृत्ति पैदा होगी, कुछ करने के लिए, कुछ कर करके दिखाने के लिए जीवन को लगाने की इच्छा होगी। देश के लिए जीना सीखो इस मंत्र के साथ।
इस आंदोलन से जुड़कर आपके जीवन में खुशी एवं एक नए उत्साह का संचार होगा। साथ ही अपने राष्ट्र को नई ऊंचाइयों तक ले जाने में आप गौरवान्वित महसूस करेंगे।
नमस्कार, गुड इवनिंग ऑल। डिवाइन इंडिया यूथ एसोसिएशन मुंबई चैप्टर के बिहाफ पे मैं विजय पुरोहित आप सभी का स्वागत करता हूं। आई वेलकम यू ऑल। और बहुत ही कठिन परिस्थितियों में हम लोग मिल रहे हैं जब ये कोविड-19 की जो सेकेंड वेव है इसने एक रैम्पेज क्रिएट कर रखा है हमारी कंट्री में। और ऐसे समय में आवश्यक है कि हम अपना धैर्य और अपनी जो हिम्मत है उसको बना करके रखें और अपने आसपास के लोगों को संबल दें। जैसा कि हमने एक छोटी सी डॉक्यूमेंट्री के माध्यम से देखा, डिवाइन इंडिया यूथ एसोसिएशन जो कि अखिल विश्व गायत्री परिवार, ऑल वर्ल्ड गायत्री परिवार का एक यूथ मूवमेंट है जिसकी परिकल्पना वर्ष 2006 में की गई थी डॉक्टर कलाम और डॉक्टर प्रणव पंड्या जी द्वारा, जो कि देव संस्कृति यूनिवर्सिटी के कुलपति हैं और गायत्री परिवार के प्रमुख हैं। इन दोनों चिंतकों ने युवाओं को एक मंच देने के लिए टू गिव द यूथ ऑफ द कंट्री अ प्लेटफॉर्म to engage themselves in nation building activities. This platform was envisioned और आज लाखों कार्यकर्ता दिया से जुड़े हैं और इस संकट की घड़ी में भी जिस तरीके से संभव हो सकता है अपना योगदान देने का प्रयास कर रहे हैं, चाहे वो मेडिकल हेल्प के माध्यम से हो, चाहे फिर वो राशन, ऐसे लोगों को जिनको राशन की ज़रूरत है उनको राशन देने के माध्यम से हो, ऑक्सीजन पहुंचाने के माध्यम से हो या किसी भी प्रकार से हो। दिया आज इस संकट की घड़ी में भी, जैसे कि गायत्री परिवार कठिन परिस्थितियों में हमेशा डिजास्टर मैनेजमेंट जो सेल है गायत्री परिवार का वो हमेशा से सक्रिय रहा है और आज की विषम परिस्थितियों में भी पूरे देश में और विदेश में भी जो दिया के कार्यकर्ता हैं वो इस टास्क को लेकर के चले हैं। और आज का जो ज्ञान सभा का हमारा संस्करण है, हम बहुत ही भाग्यशाली हैं कि हमारे साथ आज होंगे प्रोफेसर शैलेश श्रीखंडे जी। प्रोफेसर साहब, डॉक्टर साहब, आई वेलकम यू ऑन दिस प्लेटफॉर्म। बहुत बहुत स्वागत है आपका कि आपने अपने इस बिजी शेड्यूल में से समय निकाल करके यू कम ऑन दिस प्लेटफॉर्म टू शेयर योर थॉट्स विद अस। मैं थोड़ी सी पृष्ठभूमि देना चाहूँगा इस ज्ञान सभा के मंच के बारे में। पिछले साल जब कोविड की त्रासदी की शुरुआत हुई थी मार्च में, तब से डिजिटल प्लेटफॉर्म पे इस ज्ञान सभा के मंच को हमने क्रियान्वित किया और तब से हर वीक, एवरी वीक हमारे इस प्लेटफॉर्म पे विभिन्न फील्ड्स से जुड़े हुए लोग आते हैं, चाहे वो शिक्षा के क्षेत्र से हो, आर्ट के क्षेत्र से हो, स्पोर्ट्स के क्षेत्र से हो, मेडिकल फील्ड से जुड़े लोग हों, लॉयर्स या जुडिशरी से जुड़े लोग हों। हर वीक एक न एक कोई ऐसी विभूति इस मंच पे आती है और अपने विचार इस प्लेटफॉर्म पे वो लोग शेयर करते हैं, जिससे कि हमको एक आइडिया मिले कि और किस तरीके से हम युवाओं को राष्ट्र की बेहतरी के लिए उनको हम एंगेज कर सकते हैं और ऐसी विषम परिस्थितियों में, खासकर अभी जो कोविड का सिनेरियो है, इसमें किस तरीके से हम कुछ कर सकते हैं उनके लिए जिनको हमारी मदद की ज़रूरत है। और इसी कड़ी में क्योंकि टाटा मेमोरियल के साथ हमारा एक अटूट रिश्ता रहा है पहले से ही, BARC में जो दिया की टीम है 10 वर्षों से अधिक समय से एक ब्लड डोनेशन कैंप का आयोजन करती आई है टाटा मेमोरियल के साथ मिलके। उसके अलावा जैसा हम बातचीत में डिस्कस कर रहे थे, डॉक्टर पंकज चतुर्वेदी जी हैं, वो पहले इस प्लेटफॉर्म पे आए थे, उन्होंने अपने विचार साझा किए थे। तो मेडिकल क्षेत्र से जुड़े लोग इस प्लेटफॉर्म पे आए हैं और ये हमारा सौभाग्य है कि आज आप हमारे साथ आए हैं। और इस बहुत ही महत्व कि कैंसर के बढ़ने के क्या कारण है, रीजंस फॉर इंक्रीज इन कैंसर। कई लोगों को इस बीमारी को लेकर देयर आर मेनी मिसकॉन्सेप्शंस दैट वी हैव, और उसके अलावा जानकारी की भी कमी होती है कि इसके बारे में सही जानकारी भी नहीं मिल पाती है। तो बहुत ही महत्वपूर्ण विषय बिंदु है आज का। इट्स अ वेरी इंपॉर्टेंट एंड टाइमली टॉपिक, एंड वी थैंक यू डॉक्टर साहब फॉर कमिंग। एंड एज अ होस्ट ये मेरी नैतिक जिम्मेदारी है कि मैं आपकी प्रोफाइल एक बार हमारे दर्शकों को, जो श्रोतागण हैं, उनको बताना चाहूँगा। प्रोफेसर शैलेश वी श्रीखंडे, MS MD FRCS। आपकी विभूतियाँ बहुत सारी हैं, तो इतने कम समय में उन सबको पढ़ना मुश्किल है, बट आई विल स्टिल ट्राई एंड डू जस्टिस टू द एक्सटेंट दैट आई कैन। Deputy Director of Tata Memorial Hospital, HOD of Cancer Surgery and Chief of Gastro, Intestinal, GI and Hepato, Pancreato, Biliary, HPB Surgical Service. First HPB specialist and second Indian to be awarded Honorary Fellowship of American Surgical Association, ASA. Chairman of the Scientific Committee of the International HPB Association and Treasurer of the Asia Pacific HPB Association. Chairman of the ICMR Committee for Developing Guidelines for Management of Pancreatic and Gastric Cancer in India. Associate Editor of Langenbecks Archives of Surgery, and also on the editorial boards of leading international journals of GI and HPB surgery. Awarded Doctor of Medicine, magna cum laude by the University of Heidelberg for his original clinical and basic research on chronic pancreatitis and pancreatic cancer in 2006. First Asian to be awarded the Kenneth Warren Fellowship of the International HPB Association in 2005. Chief editor of 9 educational books in oncology, authored 71 book chapters and 271 scientific publications in leading international journals. Quite a prolific profile, Dr. Saab, and I'm sure we'd be benefited by your thoughts today and what you have to share with us. Without much ado and without wasting any further time, I very humbly request you to share your thoughts with us.
Thank you so much, Advocate Purohit, and of course, DIYA Foundation. A real pleasure and privilege to be here with all of you on this Sunday afternoon. The topic given to me or assigned to me is to speak on cancer. And we know that cancer is something which is increasingly known. This is something about which we are more aware than ever before. So it's a combination of increasing incidence, more prevalence, as well as getting more reported cancers because of more awareness. So I'll try to talk with you for the next half an hour to 40 minutes on a very broad-based topic. I understand that a lot of people in this audience are not necessarily doctors or with a medical background, but of course this would be hopefully some degree of addition to your general knowledge about cancer. So the changing face of cancer is that there is a dramatic increase worldwide, and this increase is the most in LMICs, that is low and middle income countries, in the past 3 decades. Cardiovascular accidents, when I say that, it means brain hemorrhage, heart attack, etc. Traffic accidents or vehicular accidents and cancer are amongst the top 3 killer diseases in the world. Our lifestyle has changed. Our environment has been destroyed, and this is a man-made problem. Infertility, increasing consumption of tobacco and other addictions are largely responsible for the development of cancer. But side by side, our understanding of cancer has also increased a lot in the last 2 or 3 decades. And because we understand cancer better, we are also able to give treatment for cancer much better than ever before. Now, what is a cancer? In this picture, you see on the left side, all these structures or all the cells in the human body made by God, they have a very clear, well-defined, organized structure. But what you see in this blue is that there is no structure and there are cells which become abnormal. It all starts with one single cell, and the cell learns or develops abilities which disobeys the rule of the body and the organized systems of the body, or some people would know it as SOPs, and they follow a different SOP of their own, and then they start becoming abnormal, and they are the cancer cells. They travel via the blood or lymphatics. which drains all the fluid which we don't need from the blood system. And then also they spread to the other organ via the blood and other forms of spread. And cancers don't happen just in human beings, they also happen in animals. So this is what a cancer cell looks like under the electron microscopes. Now, what about India? This profile is about 2 years old, and you can see that in 2016, we had 106 people or individuals per 1 lakh population. But in 2019, the number was already 258 per 1 lakh population. And you also have some figures which will tell you what we had predicted in 2011, and then what's happening in 2020, and then where do we stand in 2030, where you will have perhaps the male cancers being about 55%, while the female cancers would be somewhat lesser, is what we see. Now, we have got some cancer registries in the country to give us an idea. India is a continent. Our data documentation is weak. And let me use this as a public forum to openly declare that we need to be far more careful what we document and what we communicate. The recent problems in the pandemic have also been because of lack of detailed documentation. That is something which we need to bring it into our DNA if we want to really become a great nation. Now, you have these 5 registries in Bangalore, Barshi, Chennai, Mumbai, and Delhi. And you can see that the incidence of cancer in this country is the highest between 35, and then it keeps on going high till about 70s. The life expectancy of an average Indian is about 65.9, 66 years. But if a child lives for the first 5 years of her life or his life, the child, then we are likely to live for 75 years. So a large part of our problems is young mortality or infant mortality. If a child lives for the first 5 years, the chances are that we will live for 75 years in modern day India. So these are the bad statistics that I have provided you. But in the last picture, you also see that since 1970 to now, in the last 50 years, cancer survival has doubled for all comers. Say if 25% people lived in 1970, today you have 50% people who are living in 2020. Now, what are the cancer trends in India? About half of the states of India have a higher incidence than the national average. The national average is about 131 per 100,000 people, but you see that there are some states which are darker than the orange. For example, our state of Maharashtra, from where we are just now talking, we are a little below the national average, and this is a good sign, 128.2. But you have certain states in central India and North India, where about most of these states in the north and northeastern parts of India, they have an incidence which is above the national average. Now, you also have states with highest prevalence rates of certain common cancers. And you can see that again, it's in the Northeast, in Gujarat, in Manipur, in Nagaland. I won't list all this, but this would be a part of the presentation that would be available, I'm sure, for all of you who are interested. Now, where do we stand in the whole world together? Because India belongs to a low and middle income country, we still are a less developed nation. I saw this beautiful documentary with the late Abdul Kalam speaking about how he envisioned a superpower in India by the year 2020. We still have some time to go, but I think he has been an inspiring figure, and we should not forget what he has said. I have read his book, Wings of Fire, and I think that is something which has kept me motivated amongst many other things that I do in my world of cancer surgery and cancer administration. But you can see here that in the whole world, the incidence of cancer from 2012 is going up to 2035. It's constantly going up. But look at the green bar, and these are the developed countries or the G8, G10, G12 countries where the incidence of cancer is showing a sign of plateauing. This means that multiple aspects are working well and falling in place well, because of which cancer is not on the rise. India, unfortunately, comes in the yellow line, where we are a less developed nation, and one can expect cancer to be, unfortunately, a top killer for the next decade, if not more than 2 decades, starting from now. And we have a lot of work ahead of us if we want to kind of match the figures that we see in the more developed nations of the world. That's the background. Now, just to briefly give you some idea about some cancers, you might hear these words, and this I won't go into details. What you see is a picture under the microscope of a biopsy or a sample of blood which is taken, and the pathologist is able to see under the microscope different architectures. So sometimes you will read a report of carcinoma, and carcinoma is something which is a solid tumor affected cancer, commonly seen in lungs, stomach, liver, pancreas, large intestine, small intestine, breast cancer, cervical cancer in women, etc. On the other hand, if you hear the word sarcoma, you should know that it is mainly coming from the bone or cartilage or fat or muscle, what we call as soft tissue. And leukemias and lymphomas are cancers of blood cells. Now, there are 2 types of tumors also. You can have benign tumors, which is also a tumor, a lump, worrisome but not bad. And you can have malignant tumors. So you have a situation where you have normal cells and benign cells in the picture on the left side, and you will see that they do not spread anywhere else. So here, these benign cells which cause a tumor, they stay intact. Compare it with the picture on the right side where these bad cells spread. And that's the difference between a benign tumor and a malignant tumor. The most common question that people ask me nowadays, in this era of anxiety and in this era where everybody is constantly looking at his or her own self, and that's about signs and symptoms of cancer. How do I detect cancer earlier, or how do I know I have a cancer? Now, the job is not so simple, and I must tell you that there are more than 200 cancer types. Majority are not genetically inherited. Only 5% are genetically inherited. So most of them are de novo cancers, and they are not necessarily running down in families. In the initial stage, they hardly manifest with any symptoms or signs, since the problem, as I showed you in my previous slides, belongs or begins at the cell level, and we don't experience any sensations or symptoms as human beings. And signs and symptoms are often related to the organ which is affected, how aggressive is the tumor, and the type of cancer, carcinoma, sarcoma, etc. Now, you get symptoms which sometimes often already tell us that it is something which is more advanced. And that is a sense of malaise, tiredness, weight loss, lump in the breast, changes in the skin, or there is a change in the way our routine bowel habits are, or how the symptoms of urine or how we pass urine. There can be a change in our voice. There can be blood which can be mixed with stools, or you can have blood in the urine, or you can have persistent cough or fever which periodically keeps on coming up. All these, or a combination of these, can be signs and symptoms of cancer. But I say they can be signs and symptoms of cancer. I don't want everyone to start thinking whether I have this and whether I have a cancer, because cancer is largely an uncommon event, is what I want everyone to know. Now, there are certain cancers which are on the surface of the body, and so they can be detected earlier than other cancers. For example, breast cancer can be detected early, A thyroid cancer in the neck can be detected early. A cervical cancer, especially as the socio-economic strata and the level of education increases, a cervical cancer can also be detected earlier than others. We have number of tests, and I'm not going to go into details. I would rather keep this for question answers. But you have to examine the body from the inside, from the available lumens or available orifices that we have in the body. For example, if I want to look at the food pipe and the stomach and the intestine, we have something like the endoscopy. Then with the help of sound waves, we can do an ultrasound by using the transducer on the body and see inside by sending sound waves inside and getting images. And that's what an ultrasound is. But we have superior technology like CT scan and MRI and PET scan, which can very precisely tell where is the problem in which part of the body and what is the dimension. And all this is possible in about 95% of the cases with great accuracy. Of course, a final diagnosis, a final proof of cancer depends only on a biopsy, without which it only remains a suspicion. After all these tests are done, your doctor might be in a position to tell you whether it's stage 1, stage 2, stage 3, or stage 4. And how do you plan treatment? That depends again on organ affected, grade, stage, age of the patient, health of the patient, location of the tumor, one site, more than one site. Multiple factors are there which we need to consider before we offer treatment. It's not that treatment can be given which is the same for every patient. Two patients may have the same cancer, but the treatment that we offer may be a little different in patient X versus patient Y, because no two human beings are the same. Now, is there some good news with all this? Yes, if you have cancers in stage 1 and 2, and some early stage 3 cancers, they can be cured. And that's why if you look at all the Tata Memorial logos, especially on our vehicles, we always write that cancer is curable if detected early. It's all about awareness. It's all about being aware and taking help on time and being able to detect it earlier than ever before. Now coming to a topic which also interests everyone, including researchers and not just lay people, what are the causes of cancer? The commonest cause is tobacco, but I want everyone else to look at the other factors as well. Excess weight and obesity, a sedentary lifestyle or a lack of exercise, a diet which is not a balanced diet. You can have occupational hazards in certain chemical industries, etc., where you might have problems. You can get exposed to certain viruses, and they can also give rise to cancer. As I told you, a family history or hereditary cancer is there in about 5% of cases. Alcohol can also contribute to the development of cancer, and there are a number of other factors which can cause this cancer. Now, which are the cancers that are caused by smoking? The commonest are in the oral cavity, in the lung, in the voice box, that's the larynx, as well as the digestive tract or the gastrointestinal tract. They are all listed here, but the pink circles tell you the biggest impact of smoking is on lung cancer. You can see that. But they can also be highly responsible for urinary bladder cancer. They can be responsible for pancreas and intestinal cancer, and they are also responsible for nose, mouth, sinuses, upper throat, and the larynx, which is known as the voice box. These are all the head and neck cancers which are caused by smoking and tobacco. On the other hand, when it comes to alcohol, you can see that large intestine and breast cancer and mouth and upper throat cancer are damaging the cells, and that damage increases if alcohol and tobacco are being used together, and then you can get these cancers caused by alcohol, more commonly of the throat, the food pipe, the voice box, that is the larynx, breast, liver cancer. The biggest metabolic factory of the body in the digestive tract is the liver. So liver can be very badly damaged with alcohol, giving rise to cirrhosis and ultimately resulting in liver cancer as well. Now, There are also cancers which are caused by sedentary lifestyle, and you can see from the list, almost every major cancer in the body can be caused by a lifestyle which lacks in exercise. So I know that I'm talking to an organization which is focused on the youth and for a healthy and a better nation. We are a great nation, but we obviously want to make it into a far better and a greater nation. And like you, I too am committed for the same cause. And what is more important is that unless and until we take care of our own selves with a lot of discipline, with a degree of exercise, and respecting that the human body is one of the most beautiful creations in the world. Nobody has been able to create a human body the way the supreme creator, the way God has created it. And it's a real pity and a real shame if we do not respect it just because we lead an unbalanced lifestyle, and then you can get these kinds of cancers just because you haven't done regular exercise or led a very sedentary lifestyle. I did tell you that viruses can cause certain cancers, and you can see that hepatitis B and hepatitis C, again related to very poor practices, are very common in India and Southeast Asia. And then you can get liver cancer. And there are a host of other cancers, especially the human papilloma virus, HPV, which can give rise to cancers of the cervix, the female reproductive areas, the vagina, the vulva, the oropharynx, as well as the anus. So these are important diseases, and we need to take care that we take care of ourselves so that we hopefully do not get these viruses which can be playing a role in the development of cancer. I already told you at the beginning of my lecture, so I won't go into the details, knowing that we are talking to a general audience. But how and where does cancer spread? Broadly, I can tell you that if the cancers are beginning in the digestive tract or in the belly, a large number of them will first go to the liver, then they will go to the lung, and then they will even go to the brain. But there is something like lung cancer, which you see in orange over here. They are known to go to the liver, and they are known to go to the bones and also go to the brain. So there are different avenues and different channels by which different cancers can spread to different parts of the body. Now, the journey of cancer, as I told you, is starting from stage 0. And that's very, very, very early stage cancer. And stage 3 is already a worrisome and a bad situation, and we may not be able to cure, while stage 4 is almost never cured, barring exceptions. So cancer starts in a cell and stays dormant for a very long time, and then the stage gradually increases. So this is how things are when it comes to cancer. And the rate of progress varies amongst different cancers and amongst patients. So no two cancers in no two patients are the same in terms of how they grow, what is their speed, when do they stop, how do they respond to treatment. All this is completely different. Now, I'm not going to go into details, but are there differences between men and women? Yes. In men, commoner cancers are lung and prostate and large intestine and rectum. In women, a very common cancer is breast cancer. Fortunately, on the surface, can be detected better, and you have a very high chance of treating women to cure breast cancer, which is very common in women. Men can also get breast cancer, but at a much lower incidence. You also have a very high incidence of lung cancer in women, and then also cancers in the large intestine and rectum. This is only to warn people as to how things can get bad if you are focused on gutka and tobacco and cigarette and bidi. Some of you will feel horrible looking at these images, but this is what happens, and the person can not necessarily be an uneducated person. We see a large number of people who just get addicted, and then they come with these kinds of lesion, which is a very bad situation. These are tumors in the belly, which is just to educate people that all solid tumors are best treated with the help of an operation, whether it's a stomach tumor or a pancreas tumor or a liver tumor or a large intestinal cancer or you can see a cancer of the ovary in women where we have to do an operation to take it out. Now, there are some cancers which are very bad in terms of survival, and you can see that as the stage becomes worse, the survival comes down. Pancreatic cancer is a very aggressive cancer. Lung cancer is also an aggressive cancer, but things have improved in recent years. While in breast cancer also, you can clearly see that we have a good chance of long-term survival in patients with breast cancer. As I come towards the last half of my talk, let's look a little bit at treatment modalities. That's doing surgery. As I told you, for all solid tumors in the body, if the tumor is located and localized to one organ or maybe one or two, then surgery is still by far the best treatment despite improvements in chemotherapy, immunotherapy, radiotherapy, etc. I don't say this because I'm a surgeon, but this is the rule when it comes to solid tumors in cancer. And this is also important to tell to all of you, because people sometimes get a feeling that with so much of advanced technology, one can avoid something like an operation and try and treat themselves with other modalities which will not help you. In fact, the cancer will worsen. And then I get a lot of patients who are coming to me in stage 2 and stage 3, when they could have actually come in stage 1 and stage 2, got an easier and a safer operation, and got a much better chance to live long. So that's surgery for solid tumors. Chemotherapy is also there, which is used as an adjunct to surgery so that the microscopic cancer cells in the body can be removed with the help of drugs. Chemotherapy is also very useful, especially in pediatric or childhood cancers, where in some the side effects can be high, but they can be completely cured with modern day chemotherapy in the pediatric or childhood cancers as well. And then you have radiotherapy with high level technology, where radiation is given in a very focused area in the body without damaging the other organs in the body. This is highly specialized, and normally modern treatment of cancer is involving a combination of surgery, chemotherapy, and radiotherapy. You also have other things like targeted therapy and precision medicine and immunotherapy that you must have heard. And I'll try to make it simple in one slide. What is targeted therapy for you? So targeted therapy is that you work at different levels at the cell to try and destroy the bad cells in a way that you don't affect the rest of the body, but either destroy the bad cells or the pathways or the channels by which the cancers grow. So it blocks specific pathways that are responsible for cancer growth or development of cancer or spread of cancer. These are three different words: increase in size of the cancer, or development from normal to abnormal, or the cancer spreading. And you can have specific drugs based on modern research which will block only selective pathways, so their side effects are much lesser as compared to chemotherapy, but they are also more expensive, and they are not available for all cancers. They are available in some cancers where targeted therapy works very well. It is a form of precision medicine. And immunotherapy is a way where your own immune system is activated to fight against your own cancer. So every body has their own defense mechanism in place. So we try to use medications or means by which we activate or give a boost to the existing immune system, so that immune system itself can attack the cancer from which the body is suffering, or the person who has been attacked by a cancer. Now, I won't go into these details. Sequencing means that what you do first, surgery, chemo, radio, this depends on what type of tumor, what stage, what sort of treatment facilities available, what is the chance of cure, and these are complex medical decisions which require multidisciplinary care when it comes to management of cancer. An important part of this talk is going to be the best thing, as we've always learned since childhood and in school, that prevention is better than cure. Now, when I speak of tobacco, I know there are people who would get tired listening to tobacco, but I don't know how many of them know that 33% of the world's head and neck cancers, cancers of the mouth, the tongue, the nose, the sinuses, the food, the aerodigestive tract, the larynx, 33% of these cancers are happening only in this one country in the world. The United States has only 2% of these cancers. And the simple reason is tobacco. So if you just want to reduce the burden on the hospitals, if you want to reduce the financial burden on your health and on your family, and if you want to have a chance that you will not get a cancer of the mouth, the tongue, the nose, and all these areas, just don't take tobacco in any form. And that will already keep you away from drugs and devils and doctors. That's the way I would like to tell you. The other thing is a well-balanced diet. Fortunately, India is such a rich country in terms of resources, and I travel all over the world, and it's easy to say that we get all the food that we get in India because we are such a vast continent where there is availability of almost any kind of food that you seek. It's available. But when I travel to places like Korea and Japan and other small nations, they don't even have the land to do any agriculture. And they have to depend on such difficult avenues to try and just get some basic food to survive. So we are rich with variety of foods that are available to us. But I think it's much more important. It's very important that we try and make sure that we lead a balanced diet. Anything in moderation is good in this world. Anything which is not in moderation is always going to be bad. Nature will never forgive you if that kind of a situation is present. I told you that overweight is a bad thing for your heart, for your metabolism, for your blood sugar, for your hypertension, and for development of cancer. So it's a good idea to not be overweight. And one way is to have a controlled diet, not stay hungry, but a controlled diet. There is a big difference between need and want. The minute you want wants, you have big trouble coming up round the corner sooner or later. And regular exercise should be along with a balanced diet, and you will be in a much healthier frame of mind when it comes to your brain working, when it comes to your metabolism in the body, and the way the cells in your body will behave. And as I told you, cancer is an uncommon event if you lead a disciplined life. I'll speak a little bit more about that afterwards. It's important that, yes, in women, we need to think about human papilloma virus vaccination that can help us, especially in cervical cancers and some other cancers. High-risk behavior is always to be avoided in any form because hepatitis and other transmitted diseases are a precursor for development of cancer. So one needs to be careful about that. And when I say a regular checkup, it doesn't mean a regular executive health checkup by spending a lot of money. It's just about checking your weight once in 3 months, and after the age of 40, perhaps doing some simple blood test once in 6 months. Or if there is a family history of a cancer or something, it's good to talk to your general physician to know what are the chances of you getting a cancer in the future. Are there cancer-fighting foods? We have some information. We don't know whether that information is fully reliable. If you go on the internet, you will get confusing information. So I don't spend too much of time on the internet for things like these. But yes, there are certain things which I have listed on this slide where perhaps they are protective and they can help us to fight cancers better. But again, everything in moderation, everything that is clean and cooked well, rather than just a westernized diet or too much of reliance on fast food is going to be a problem. Too much of reliance on meat for non-vegetarian food is also a known problem in development of large intestinal cancers and other cancers. So yes, you can follow some of these cancer-fighting, cancer-preventing foods. A diet which is rich in salads and vegetables is perhaps a very good diet, both for health as well as for preventing cancers. Now, this is my last slide. The challenge of cancer in India. I want everyone to understand that our population is our big drawback in this fight against cancer. The whole country and unfortunately the whole world has seen what has happened with the COVID pandemic, which is ongoing. Yes, we speak about organization, we speak about complacency, we speak about doctors, lay people, and administration and lack of vision, etc., etc., etc. But actually speaking, the biggest problem is that we have a huge problem of demand and supply. Our population is just too large. It's just too massive. So whatever you do, we are likely to come short. And I have a saying which I have learned from my father and which I use every day in my work, especially since I do complex GI and liver and pancreas and gallbladder cancer surgery, that unless you sweat in peacetime, you will bleed in wartime. So I think it's more important when we don't have a pandemic, when everything is good and happy, we need to work that much more harder, not just at our population, but in organizing our systems, in getting our education to a very good level. Otherwise, there will be one pandemic and then there will be some other calamity in the future, the way nature and God wants it. And we will still be struggling to match the way the rest of the world or the developed world has dealt with calamities and emergencies. Poverty, hunger, unemployment, and corruption have all contributed to lack of development and access to healthcare over many decades. So though India has improved a lot, we still remain a low and middle income country. We still are not a middle income country. We are an LMIC and we need to be aware of that. Surgery, again, not because I'm a surgeon, but it has made tremendous strides in the last 20 to 30 years. And major and supra-major surgeries on par with the best in the world are clearly undertaken in India, at least in centers of excellence like the Tata Memorial. It's not just the surgery, but it's about the teams, it's about medical oncology, chemotherapy, radiotherapy, everything working together, which has caused a lot of improvement in outcomes. So is cancer care much better in India now than what it was 20 years ago? Clearly. I joined Tata in 2001, and I can tell you that in the last 20 years, we've made a lot of progress. But the problem also remains about uneven standards of medical education. So if we really want to have the standards that we have in Tata across the rest of the country, we clearly need to raise our bar in terms of medical education and the services that are offered at different levels. And then only we will be able to decongest our big cities, big hospitals, and then carry on with good care across the whole nation. I think that's an important goal with which I have identified and continued my career. Escalating cost of treatment needs to be addressed as a priority. Unfortunately, more than 75% of Indians have to resort to out-of-pocket payments for covering their medical expenses. We need to rethink about how we want our healthcare to be delivered and how we want to save, how we want to get insured, because complex and modern medical healthcare is expensive. It's easy to say that we want to give and we will give you free treatment, but I think in this world, nothing happens for free. So we need to work for it and we need to devise systems so that health, which is a basic human right, is respected with a degree of dignity and we are able to give that kind of care. So I need to have that flexibility to be able to treat the commonest and the poorest of people with world-class care, something which we are able to do in Tata, but I'm not talking of Tata Memorial, I'm talking of the whole country as a whole. So there are challenges to cancer care in India. And then we should not ignore the mental health part of, whenever there is a cancer, it's not just a cancer patient in one family, it's the whole family which gets affected. It's the emotional health of patients, families, and even the caregivers. So common feelings during this life-changing experience include a lot of anxiety, distress, even depression. And my job is not to just be a technically good surgeon and solve the problem. I need to work with everything with a heart and see the whole situation and then offer the best of care. Roles at home, school, and work are also affected. So you can see that this is a multidisciplinary event that happens, that's going to involve multiple stakeholders if you want to treat someone with cancer and the near and dear ones who are affected by this disease. So it's important to seek professional help early, and then even places like Tata Memorial has dedicated palliative care and other services where we can reach out and give you connectivity and helplines. It's also important to remember about palliative care and pain management. A large number of patients will be stage 4, a large number of patients we might be helpless and won't be able to offer cancer care. And then we need to understand the concept of what is end of life, hospice care towards the last phases of cancer, so that they live a life of dignity as fully as possible and as comfortably as possible. And then, of course, you need support groups for patients with cancers of a particular type or cancer treatment of a particular type, so that they can exchange their thought processes. Pain is one of the big challenges in some of the cancers, and even pain medications are not available across the length and breadth of India when it comes to cancer pain management. Today, everyone's talking about COVID, but you need to be aware that these are other challenges which have been calamities, if you ask me, for decades together, and we need to address this beyond the challenges of COVID that we are faced with. I think no talk presently gets over without COVID, but I want to assure people that Tata Memorial has continued to offer cancer care, because we should not forget that when there is COVID ongoing, there are people who are dying with heart attacks, there are people whose cancers are progressing, and it's wrong to not offer them treatment. So we have continued treatment in such a way that I've not taken a single day of holiday since the national lockdown on 22nd of March last year. The same 3 basic precautions. Of course, I am now vaccinated, but the same 3 basic precautions have helped us to continue work. And it's not about Dr. Shrikhande. It's about the whole institution, Tata Memorial, which has continued to work with its 3,000 strong staff. We've had nurses who have not gone home for 4 months because they might take some risk back to their families or to their husbands or to their in-laws or to their small children. And they have stayed in the hospital for 4 months at a stretch and continued services. This is what defines service, which is truly selfless service. We have participated more recently in sending O2 concentrators all over the country. We received national acclaim last year for doing more than nearly 500 operations, and this was recognized in the world's top journal, where we operated 494 patients without a single patient dying of mortality. And this of Tata Memorial in Mumbai continued across the other centers as well. So we could do 4,000 cancer operations, elective, not emergency, planned cancer surgeries from March till mid-July across India in other centers as well. And then, of course, this year we have had a situation where we have continued to see that we try and educate people. We learn from other countries like the UK, and we've exchanged notes with them, how they dealt with the second pandemic and the second wave. And we have tried to transfer this information across. And here in this talk last year, you can see that I'm trying to reassure people when it comes to cancer, immunity, and COVID, and yet we being able to continue treatment. So I want to give hope to people that it's not the end of the world when it comes to cancer and COVID. Cancer does compromise immunity, and COVID can attack patients with cancer with compromised immunity, but a large number of them can be managed very well. So Tata Hospital is one of the hospitals where we have segregated cancer patients with COVID and cancer patients without COVID and continued our treatment. So it's not a hopeless world, and we will all get out of this well by just basic adherence to 3 things without panicking and leading an organized life. And very soon we will have the end of this pandemic as well. I think with that, I stop my talk here. Thank you for your time. I'll stop sharing this presentation, and I will be with you now for whatever questions that would be coming to me. Thank you.
Thank you so much. Thank you so much, Dr. Saab, for that wonderful primer on cancer, on what Siddharth Mukherjee called the emperor of maladies. So thank you so much for giving us a thorough understanding of what types of cancers are there, how best to treat them, and importantly, how to have an awareness about the disease rather than just jumping onto conclusions and doing something that is not conducive. And we would also like to thank you and everyone at Tata Memorial Hospital, including the nursing staff, for the untiring efforts during the pandemic, as you mentioned, because this is a great service. And I mean, we can't thank you enough for the service that you have done for people and continue to do so. Thank you for that, sir. And with that, we are flooded with questions. Of course, we have limited time, so we'll
I'm
try
here
to
with
pick
you.
the
Tell me.
sure. So we'll try to pick the most relevant ones, and those which are which would be helpful for the greater audience. So I'll begin with something very basic, sir. Uh, there are a lot of misconceptions about uh, diagnosis. How, when does it get diagnosed? So a lot of people have asked, is it possible to have it diagnosed early so that it can be cured? And what are the types of these
So
diagnosis?
it's a difficult question, because as I told you, there are more than 200 types of cancers. But we must be aware that there are certain cancers which are more on the surface or can be seen to the eye. For example, cancers in the mouth or in the cheek or in the upper throat or in the breast or in the private parts of both men and women can actually be detected very early. And that is just by paying attention to your own body. That doesn't mean that you become neurotic and keep on checking yourself every day. But what did I tell you? If you are doing wrong things, like unhygienic practices or hepatitis B or C infection or tobacco or alcohol, then you are the one who is more likely to disturb your body's equilibrium. So when the question comes to me that can you detect cancer early, there is no wonder test or a single blood sample that you take out and you can detect cancer. The word is fashionable, a liquid biopsy, that I take a blood and I scan it through a fancy machine and then I can detect one of the 200 cancers. No, it doesn't happen as yet. So it's not easy to detect cancers very early. But if you lead a life of moderation, at least the surface cancers on the body, on the face, can easily be detected much earlier. And the whole thing boils down to awareness. So if you have an ulcer in the mouth which is not healing, rather than saying that, oh, I ate something spicy, I've been stressed, I slept late, the more important thing is to see a doctor in time. If you do these small things, you will detect cancers far earlier than later.
Right. The next question is, cancer can exist only in a certain neurotic state of mind, or does psychological conditions also lead to cancer? That is, when the mind becomes very tense,
Yeah,
so tense that it is intolerable, it starts affecting the body tissues.
yeah,
If
yeah.
there is any
It is.
preliminary study or something.
So there is some work which clearly tells you that a positive state of mind will enable you to fight your disease or your cancers better, because a positive state of mind improves and boosts your immunity. So if your immune system is stronger, you will withstand both the physical and psychological trauma of a cancer, as well as the treatment related trauma of the cancer much better. So I've always told my patients that the one with a big heart and a positive mind, I've seen big cancers become small. I've seen big operations, they recovering from the operations in no time. And I've exactly seen the opposite as well, that small operations become complicated. Early stage cancers tend to spread or become more aggressive, and patients don't respond as well to treatment, especially if you are in a negative frame of mind or if you are having psychological disturbances which are not being addressed well. So it's important in any event, not just for cancers, to try and be calm, and you will be able to deal with an emergency or a challenge much better, generally speaking, in life.
Like mild leukemia. It is often said CML patients, they do at times tend to complete their lifespan, and it's relatively in modern times, in recent 10-15 years. So is it true that CML patients, they do tend to
So,
complete their
so,
lifespan or their
yeah, that's true. There are a number of cancers where we have converted the cancers into chronic diseases. And CML has been one of those cancers where we found one of these targeted therapies about which I spoke to you about. So this targeted therapy was taken care of by a wonder drug which came from Novartis at the turn of the century, known as Gleevec.
Gleevec?
Yes, and this has been one of the hopes of cancer, where we want to discover more and more targeted drugs like this. So we have converted CML into more of a disease where you will get a length of life, but you will have to live with that disease with certain medications. Lymphomas is another fine example where a lot of chemotherapy has made progress, and you can give long life to patients with lymphomas as well. So yes, we have our own, despite Siddharth Mukherjee's book, which I agree partly and not fully, there are good things which also continue to happen with cancer.
Right. This question is in respect of mobile phones, whether radiations coming out of mobile phones, are they a cause of cancer? Is there any study on this?
There is some preliminary data. There is some preliminary data that it may be responsible, but there is no clear cause and effect relationship established with conviction. But having said that, I clearly see that when I am in Europe or in Japan and in America, the use of mobile phones is far more restricted to work than what I see in this country. And I must tell this to the youth. I still consider myself to be very much a part of the youth. Though I've just turned 50, I still play cricket very actively. And I can tell you one thing, that it's important that things like telephones and televisions, they are great technological aids, but do not become too over reliant and self-absorbed in these things and lose your individuality. The brain is actually created to see, smell, absorb, read, and write, and then you use the brain rather than being constantly fed by something like a mobile phone. So again, anything in excess will cause you troubles. I use a mobile phone, maybe it causes a cancer, but we need a mobile phone. But I won't overuse it as far as possible. That's all that I can do.
Right. Right. Now, someone has asked a question about relapse of cancer. How to prevent relapse? What precautions should be taken to avoid? I mean, I understand there are many types of cancers, but generally, what should one do?
Broadly speaking, if you know what is the potential cause of your cancer, that cause of cancer has to be completely avoided. For example, smoking or alcohol or whatever. If you have got a cancer related to that, those habits need to be completely stopped. And I say it is complete and permanent cessation of smoking or tobacco or whatever it may be. But even after doing that, is there a risk that cancers can come back? Stage 1 cancers, the chance of they coming back is less. Stage 2 cancers, some of them can come back. Stage 3, the chance of they coming back is higher. So I think higher the stage, more closely we have to see the patients in the follow-up even after they complete the treatment. So there are variations for different cancers where we may call the patients back to the hospital or through teleconsult. They keep in touch with us every 2 months or 3 months for the first 5 years after the treatment is complete, for us to see whether there is any chance of detecting an early relapse and then see what we can do. But clearly the inciting factors, if you know them in a particular cancer, avoid them. That's very clear.
Interesting that you mentioned about alcohol, and I also saw that in one of your slides. It's a misconception that only smoking can cause cancer. Is it true that alcohol also causes cancer?
Yeah, if you have it in excess, yes. It's a form of social drinking is allowed in many cultures. So while tobacco would have absolutely no benefits, there may be some benefits of alcohol, but the bigger problem is alcohol is also a poison. So, when I say defined in limits, if you speak to the cardiologists, if you speak to internal medicine specialists, there is a certain restricted amount which is potentially harmless. But it's very important again to be self-disciplined and in moderation. If not, alcohol is a poison. Alcohol can cause gastric cancer, liver cancer, pancreas cancer, breast cancer, intestinal cancers. All these cancers can also be caused by alcohol. But the relationship with tobacco is unequivocal and very strong. That's not the case with
Right.
alcohol, except in liver.
Uh, you mentioned gastric cancer, and someone has asked, what is the
Prognosis.
prognosis of gastric cancer? Prognosis
Yeah.
of gastric cancer,
So if I
as
take
such, especially in India.
Yeah, so if I take all comers, and when I say all comers, if I take stage 1, stage 2, stage 3, stage 4, all of them together, then it's a very bad story. You will have 10 to 15 people out of 100 who will be alive at the end of 5 years. But that's because I have taken stage 1 to stage 4. But let's look at stage 1 to stage 3 only. These are the 3 stages where you can treat cancer by surgery, chemotherapy, etc. And if they get complete treatment, you will have about 45 people out of 100 who will live for 5 years after complete treatment, and the ones who live for 5 years have a good chance to even live for 10 years. So again, the same thing. If you detect these problems earlier, for example, stage 1 gastric cancer is uncommonly treated by us, far more commonly treated in Japan and Korea because of awareness. They know their numbers are high. Patients go to doctors earlier, they detect them earlier, they treat them earlier. Stage 1 gastric cancer, the chance of getting cured is as high as 90%. Stage 2 comes down to 70%. Stage 3 comes down to 40%. So if I put all of them together, you will get about 45 to 50 patients alive at the end of 5 years or longer for stage 1, 2, and 3 put together in gastric cancer.
Right. One important aspect for the family, once a person is detected, it's a long, the treatment and everything. What would you tell to a family of someone who's been detected with cancer? What should be their roles and responsibilities? And how should they educate themselves in understanding cancer care? And I mean, what should be their role in the treatment and the entire process?
Well, I think the most important thing is that they need to understand the complexity of treatment involved, the duration of treatment that's likely to run its course, the kind of problems that they might have to deal with because of the treatment we give, and the advantages. So it's the risk benefit ratio of the treatment we offer to a particular patient at a particular stage for a particular cancer. But it's important that they understand that they are the ones who are around the patients, who are going to support them, the caregivers. If they completely understand what's going to go on with the patient who belongs to them, they'll be able to support the patient much better psychologically and physically. And if the whole family understands everything well, it becomes that much more easier for the treating doctors and their teams to handle things. So I think communication, very clear communication, is very important, especially in the initial stages when we see a patient and treat them. And then there are multiple avenues in terms of information availability, some of which is generated by us. For example, in my team, we've got things where we completely educate them as regards their cancer and the type of operations that we may have to do, so that they understand it very well as to what they are going to undergo, why they are going to undergo, and how they will come out of this at the end of all this. So I think it's important communication, having the heart and the emotions, making the family fully aware, making them aware of the finances involved, as well as the duration of treatment that they are likely to get into. So this changes from every household to household and every patient to patient. So difficult to give you one straightforward, easy answer. But this is the practice that I would use for every single patient while dealing with them.
Sure. I'll now slightly delve into a territory that we were talking about just before the session, that spirituality is something, I mean, do you think, or what is your take on the confluence between science and spirituality? Because as you mentioned that both these things are intrinsically related and can
Absolutely.
complement each other. Uh, so your
So I think
views on that would
there is no
certainly help.
objective research done by me or my team so far when it looks at spirituality and success stories. But there has been a day-to-day experience almost every other week when it comes to success stories and spiritual practices, or even failures and lack of spiritual practices, or the mindset of a patient. So I think you can't separate science and technology. The human body is not a machine. It's always the mind. So I think mind is something which is most important in this world. So it is the mind which drives everything. So the mind of not just the patient, but the mind of the surgical team, the mind of the caregivers, everyone, they tend to create a good spiritual environment or an experience with outcomes which are better. Almost every day, I have genuinely told my patients, as well as my colleagues, as well as my younger doctors, that I genuinely believe that my place of work is my temple. I do not visit a temple to seek some sort of a power to do better. I think it's more important that I do my worship every day with dedication, devotion, and hard work. And that's where you start creating and experiencing a spiritual experience, which I have consistently experienced. I have, just yesterday, I have a lady from Kashmir who has gone home after 59 days in the hospital. And I think she has lived because she did not die. I've done 3 difficult operations on her. She has had the most exotic of complications which can happen, we are aware, but they have happened. The family had given up. She had towards day 40 onwards started to give up, but we did not give up. And then they could see the kind of energies that were being exchanged by us and the family and the patient. And in the last 1 week, she has completely miraculously recovered dramatically. She's gone home yesterday. And these kinds of things are multiple. So to cut the long story short, have I done hardcore, dedicated, high level of research to document this? I have not. I hope I can. To do a research protocol well, it needs to be organized very well to be able to have a background, how we want to do the materials and methods, how we want to document the outcomes, how we want to compare it with a control group, and then prove it is a difficult challenge, but can be done and desirable. Hopefully, I will do it one day. But do I believe that spirituality and science and technology all go hand in hand? Without a doubt, they go hand in hand.
Right, sir. So this last question, considering the strains, it's not a matter of study, but more of experience that we tend to feel these things are interweaved. And so recently, AIMS was doing a study, or is rather conducting a study of effects of the Gayatri Mantra, because it has specific syllables, and chanting them can have a definite impact on the body, and it may help in curing certain diseases, including COVID. So do you think, because you spoke about health and the importance of health, not just for cancer, so pranayam, meditation, do these things in your experience, you've seen it helping people? What would be your take on it, sir?
Oh yeah, I think I've seen it that it helps people, and there is no harm in trying out these things. Again, I don't know whether we have the highest level of evidence, but it's great that a place like AIMS is trying to evaluate the Gayatri Mantra. And there would be situations where we would look at all these aspects. But yoga, pranayam, Gayatri mantra, they are not just simple mantras. They've had a lot of relevance, and that relevance is never going to go away. So what's their actual impact on day-to-day cancer care? I do not know. But would it be harmful? 100% not. Would it be beneficial? Very likely it would be, but I do not have a clear answer to you despite being an expert in management of cancer.
Sure. So it brings us almost to the close of this session, sir, with one remark that I would like to make, that as I told you about the Dev Sanskriti University at Haridwar, it's confluencing the ancient wisdom with modern science and is trying to do some research in this field that we just spoke about. So after the pandemic is over, we would want you to, I would rather invite you to the university once and see for yourself of study that is being conducted there, and perhaps some kind of collaboration with Tata Memorial would indeed be beneficial in this regard, sir. So we would request you to visit
Definitely.
at Haridwar once the pandemic is
I look
over, sir.
forward to the end of the pandemic. I look forward to this fine invitation from the university in Haridwar. I look forward to meeting you all in person and interacting with you. And then maybe we would have some common grounds on which we can certainly think of doing some path-breaking research together. And I hope that we can reach that mutually beneficial goal. So thank you once again,
Sure,
and
sure.
I look forward to the visit to your university.
Sure, sir. It's been an absolute honor and privilege to host you, sir. And people joining in from various platforms, not just this platform, but from Twitter, YouTube, Facebook, etc. I thank you, sir, for taking out time and problems that we are faced with in terms of cancer and the solutions that lie. Uh, we have started this small initiative when the pandemic hit for the well-being of all from 6:20 to 6:30 every evening, wherever, and we chant the Gayatri Mantra or whatever prayer is comfortable to us for the well-being of those who are suffering from this pandemic, have lost their loved ones, or require that spiritual collective energy. That's an initiative that we have started from 6:20 every day, sir. So we'd request if you, whenever it's convenient for you, you do join in from wherever you are, sir, if comfortable. Um, so with that note, I would like to bring an end to this session today with the promise that the next week we'll have someone more, or rather someone from a different field sharing their experiences with you. And I would request all of you to join me in the Shanti part for the well-being of all, and uh, uh, for the for the reason that this disease of COVID may passes very soon.
Thank you. Thank you
Om
very much.
Dyo Shantirantariksha Shanti Prithvi Shantirapah Shantiroshidayah Shanti Vanaspatayah Shantirvishve Deva Shanti Brahma Shanti Sarvagam Shanti Shanti Rev Shanti Shama Shanti Redi Om Shanti 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 Sarvarishta Shantir Bhavatu. Thank you very much. Stay safe.
Thank you. Bye-bye.
Thank you. Bye, sir.